Whether you're a person with a disability or a healthcare provider, you should know the law and what's required to ensure equal access to healthcare before, during, and after an appointment. Basic preventive healthcare is critical to ensure that people with disabilities have the opportunity to live healthy and productive lives. People with disabilities and healthcare providers must be proactive to ensure equal access throughout the healthcare visit. Patients and providers should know about the Americans with Disabilities Act, or ADA. This law prohibits discrimination and ensures equal opportunity for people with all types of disabilities. It's important to know and understand the Barrier-Free Healthcare Initiative and the U.S. Access Board's accessibility standards for medical diagnostic equipment. Learn more about your rights and responsibilities at ada.gov and disability.gov. When medical appointments are made, it's up to patients and providers to ask if accommodations are needed. Patients may need accommodations such as assistance getting onto the exam table, confidentiality filling out paperwork, or a sign language interpreter. Remember, both patients and providers have rights and responsibilities under the ADA law. Patients with visual or mobility disabilities might need help moving from the waiting room to the patient area. Never grab a patient or assume someone needs assistance. Providers should ask, "Do you need any assistance?" Let the patient tell you how to assist them. For example, patients with visual disabilities may ask you to provide an elbow to help guide them. To capture weight for someone who may be unable to step on a standard scale, the provider should use accessible scales. Accessible scales can be used by all patients, not just those with disabilities. Measure the weight of the person with their wheelchair or assistive device, then weigh the device by itself and document the device weight in the patient's record. It's important to note standard weight ranges and body mass index calculations are not reliable for those with spinal cord injuries or extremity amputations. Patients who need assistance providing a urine sample should explain to the healthcare provider exactly what they need. For example, providers may need to assist with the following: putting the patient name on the specimen cup, providing a descriptive clock layout of the restroom, providing step-by-step directions on collecting a urine sample. Disabilities aren't always visually apparent. A physician might not see or know that a patient has an intellectual, developmental, or psychiatric disability, or if a person is blind, deaf, or has other disabilities. Provider staff should ensure that the physician knows the patient has a disability and provide accommodations. Patients with a physical disability may need assistance getting onto the exam table. Providers should ask patients' preference for assistance with getting on and off the table, leg extenders, or backrests. Height-adjustable exam tables are always the safest method, but there are other options. Patients should always tell providers exactly what they need. During the physical exam, providers should use descriptive language to let the patient know what they're doing and what they're about to do. Providers should perform the same exams on patients with and without a disability. If someone accompanies a patient with a disability, providers should always address the patient directly. Providers should always ask others to leave the room for a moment to allow confidential time with their patient. Don't assume the patient's activities, especially regarding sexual health. When it comes to diagnostic tests, providers should avoid preconceived notions and run the same standard tests administered to all patients. Adjustments and accommodations may be needed for procedures such as blood work, X-rays, mammograms, CT or MRI scans, and more. As always, patients should state exactly what they need and tell providers how to provide assistance. Individuals with disabilities want and deserve to be treated with respect and receive the highest quality medical care. Clear communication between patients and providers is the key to a successful healthcare visit.